Okay, if you're a parent, you know the drill. You're constantly thinking about your child's health, and that brings up a lot of questions. One big one that pops up is about their teeth. We're talking about early orthodontics. What does that even mean? And when should you actually start thinking about it? Well, we're going to dive in and get some really clear answers for you. This is it, right? This is the number one question. The second those little adult teeth start poking through, you start wondering, wait, does my kid already need braces? It's a totally normal thing to worry about. So let's just walk through this step by step and figure it out together. All right, so first things first, let's get one thing straight right off the bat. Early orthodontics is not about jumping straight into some complicated, heavy-duty treatment. Nope. It's really all about awareness, about timing, and just some simple, gentle observation. So, what's the magic age? When should you even put this on your radar? Well, most orthodontists say around 6 or 7 years old is the perfect time for a first checkup. And you might be thinking, wow, that sounds really young. But there's a good reason. That's usually when the first permanent molars show up and they give a sneak peek into how the jaw and bite are developing. And listen, this visit isn't about getting braces, not at all. It's just about getting a baseline, a first look, to see if there's anything we should keep an eye on down the road. And this really gets to the core of what we're talking about. The whole goal here is to guide their natural jaw growth and, hopefully, head off more complex issues later on. It's kind of like tending to a young tree in your garden. You wouldn't wait for it to grow all crooked and then try to force it straight, right? No, you gently guide it as it grows. That's exactly the idea here, working with your child's body, not against it. Okay, so what should you actually be looking for at home? Well, here are a few key signs to just kind of keep in the back of your mind. Is your child still sucking their thumb a lot or maybe chewing on things? Do you notice any speech difficulties or trouble chewing food? Maybe you can see that their teeth don't quite meet upright. That's what we call a crossbite or open bite. Even something as simple as regularly breathing through their mouth can be a little clue. Now, if you see any of this, please don't panic. It's not an alarm bell. It's just a little nudge, a signal that, hey, maybe a quick early checkup would be a good idea. All right, so the word treatment. I know, that word can sound pretty scary, especially for a 7-year-old. Your mind probably jumps straight to a mouthful of metal braces, and that's totally understandable. But let's pull back the curtain and demystify what early treatment actually looks like. It's probably not what you're picturing. So instead of those traditional braces, early treatment often uses what are called functional orthodontic appliances. That sounds complicated, but it's not. Just think of them as special retainers or mouth guards. And the best part, they're usually removable and designed to be super child-friendly. A lot of kids just wear them at night. All they do is gently, and I mean gently, guide the jaw as it's growing, just to make sure there's enough space for all those permanent teeth to come in nicely. It's a way, way less invasive approach. And this comparison here really lays it all out. Look, early treatment is all about gently guiding natural growth while it's still happening. It's proactive. Later treatment, on the other hand, is about correcting problems that have already settled in. That's reactive. And as you can probably guess, correcting an established problem can often be a much bigger deal, sometimes requiring more extensive and, more expensive interventions down the line. Okay, so all of this sounds great in theory, but I know what you're thinking. What about the cost? How much is this all going to set me back? It's a totally practical and honestly a crucial question for any parent. Well, here's some potentially good news. The answer is often pretty straightforward. If the treatment is deemed medically necessary, and that just means it's needed for the actual health and function of your child's jaw and bite, not just for cosmetic reasons, then public health insurance will usually cover the cost. Now, of course, every plan is different, so you'll definitely want to double-check your own coverage, but it's a huge relief for many families. All right, so we've covered the what and the how and even the cost, but now let's get to the most important part, the why. Why does this early awareness really matter in the long run? Because the benefits can literally last a lifetime. This right here, this quote says it all. A healthy bite is more than just a cosmetic benefit. I think that's so important to remember. It's easy to think orthodontics is just about getting a perfectly straight, beautiful smile. And that's great, but it goes so much deeper than that. We're talking about a cornerstone of their overall health. So what are those big, lifelong benefits? Well, you can think of them as these 4 pillars, and they kind of build on each other. First, by ensuring the jaw and teeth are aligned, you can help prevent future complications, things like speech problems. Second, it just plain improves oral hygiene. I mean, think about it. Straight teeth are so much easier to brush and floss, which means fewer cavities. Third, and this is a big one, it can be a huge boost to their self-confidence and comfort. And finally, putting it all together, you're setting them up to need less extensive and less complicated treatments when they're older. It's a win-win-win-win.
So, if there's one thing you take away from all this, let it be this. Early detection is the whole ballgame. It is the key. It's what makes gentle, effective care possible. It's really just about laying that healthy foundation for your child at just the right time to set them up for a lifetime of healthy smiles.
And that really leaves us with one final question to ponder, doesn't it? Is a simple, brief checkup today worth a lifetime of healthy smiles for your child? When you put it like that, it really gives you something to think about.